Okay. Well, we have a very special guest here at Lean's Lodge in Grand Lake Street, Maine. The last time we were together, Andy, was in Havana.
Correct.
When we went to a meeting, and then COVID and everything else. So I'm gonna ask you to tell our viewers who you are and what you do.
Sure. Well, first of all, let me thank David for inviting me to be with you all. My name is Andrew Racine. I'm the System Senior Vice President and Chief Medical Officer for the Montefiore Health System, which is located in the Bronx, Westchester, and the Lower Hudson Valley in New York. By training, I'm a clinical pediatrician, general pediatrician, but I also have a degree in economics, so I share a lot with David.
So you mix economics and medicine.
When I can.
That makes you doubly dangerous.
When I can.
When you can. You were on the firing line in the surge, the first surge of COVID. For a short period of time, can you tell viewers what that was like for you?
Sure. I think the short one-word answer is it was frightening, very frightening actually. So on March 10th, a gentleman from New Rochelle, New York came to the hospital with a fever and a cough, respiratory distress.
March 10th, 2020.
2020.
2020, yeah.
And he rapidly went downhill, had to be intubated, went to our intensive care unit. He actually survived. That was March 10th. 2 weeks later, we had 2,000 patients with COVID in our system. So to be able to do that kind of ramp up, we were talking about adding 150 patients a day, new patients that you had to find beds for that had this disease. And this was at a point, of course, early in the epidemic where we really didn't have a lot of experience with the illness. We didn't really know the best way to treat people. We had no real medications, although Montefiore was part of the original remdesivir trial. So very early on we were using that. But it was a very frightening period of time, and we were pulling people from all different places in the hospital. We were converting areas that were not clinical areas to have beds. We were changing regular places to ICUs. We took our entire children's hospital. We put adults in the children's hospital that were taken care of by pediatricians and pediatric nurses. We were just using every available space.
Were there any protocols, long-range plans, anything that was in existence for something like this that may have helped, or is there a learning curve? What I'm at is how the learning curve ramped up from where it was, not only with you, in a large system, but through the entire country, because you have colleagues all over the country you talk to.
That's a very, very good question. And I would say it depends upon what portion of the health system you're referring to. So each hospital or large health system like ours have emergency protocols for mass casualty events, etc. No one had anything ready for the magnitude of what was happening in New York in March and April of 2020. It was overwhelming the entire system, and as a consequence, every large health system was trying to source the information, the material, and the expertise that they needed in order to care for these patients. What was interesting is it was a little bit like that expression of repairing an airplane in flight. So all of the clinicians, as you point out, were in touch with other people around the country, and we were sharing stories, experiences, what we thought our expertise was, and the ramp up, the learning curve, was extremely steep. So by certainly the summer and into the fall, if you were to take a look at the case fatality rate, that is people who were sick enough to be admitted to the hospital who ended up not surviving, that rate went way down compared to the way it was when people first arrived. We got better at doing this as we went along.
So we're now a year and a half. We see a Delta surge. We still have millions of people in the United States, no mitigation, no vaccination. They think this is a hoax. It's a Chinese microchip and all this disinformation. And we still have a political divide in the country that doesn't put, in my opinion, public health ahead of political party. Do you see that? How do you react to it? What would you say as an advice to people who are listening to you?
Well, I think that you have, as usual, identified many of the major issues here. You're talking a little bit above my pay grade. I am.
Well, you admitted to being an economist, you said. You
true.
said it.
That's
I
true.
didn't say it.
That's right. But I'm talking about someone who delivers healthcare services right now. And I would say, and you can get this not just from me, but anybody in this sector, it's baffling to people in the healthcare sector how it is difficult to convince people of the seriousness of this illness, since we see it on a daily basis, and the importance of doing anything that you can do to protect yourself. Anything that you can put between this virus and your lung cells is a good thing, whether it's a mask or it's an antibody or it's a medication. And so we constantly are encouraging people to try and do that.
One more question. We're up here in Maine. As you said to me over dinner, we're in one of the safest states in the United States. And you and Kathleen are now here. I've been trying to get that to happen for years. You got out. Today's a beautiful day. You went fishing today. How was it? What'd you do? Tell everybody about Grand Lake Stream.
Right, so this is actually this is the way you treat this disease. You get away from everybody, you get out into the middle of a lake, you're with very, very kind people, and you have a good time, because it really has been extraordinary. It's spectacular. The experience, the people, the scene, it's amazing. And it's actually probably also good for your state of mind.
Andy Racine, glad to have you visit with us here. It's taken years to get to a yes. We'll do it this way. And Norm, it's all yours. Thank you.